Good afternoon. Every time we hold one of these press conferences, our administration provides an update on public health data for COVID-19 in Massachusetts. I usually do that today and passing the torch on that one to Secretary Sutters. I think most people know that thanks to the diligence and the efforts of most residents and many healthcare workers and other essential workers here in Massachusetts, we've seen an overall decrease since May in the key metrics that we publish publicly on a daily basis. Positive test rates, number of individuals in the hospital, number of folks in the ICU, and thankfully in the number of new deaths. The notable decline in COVID in Massachusetts, especially in comparison to many other states, has caused some residents to feel a bit too relaxed about the seriousness of this virus. We cannot say this enough. COVID-19 is highly contagious and can be deadly for individuals who are older, who have pre-existing conditions or comorbidity, and in many cases also people of color. And in the past few weeks, we have seen an uptick in COVID-19 in some communities here in the Commonwealth. There have been several reports of big parties in places like Falmouth, Chatham, Winthrop, Wrentham, and Cohasset, to simply name a few. There have also been reports about illegal sports camps and private boat charters where clusters of new cases have quickly developed. And just yesterday, it was reported that a 300-person wedding was held in Gardner that is now being investigated and will likely result in fines. Now, we appreciate that we have asked a lot of the people in Massachusetts since March. Schools were closed. People have been working from home and trying to balance that with childcare. Businesses were closed for months, and special occasions of all kinds have been either rescheduled or canceled. Everyone has been and continues to sacrifice to deal with this heinous virus. People have also stepped up to stop the spread by wearing face coverings, social distancing, and staying home when they feel sick, and using telehealth to get their healthcare needs met whenever it's appropriate. Many of those preventive actions have certainly played a role in slowing the spread here in the Commonwealth, reducing our numbers and allowing us to begin the process of reopening cautiously and vigilantly. But we have to work hard, always, harder in some respects than ever, to contain COVID-19 and keep our economy open for business. We also want to keep this virus out of our communities as we head into the fall so we can give our kids a chance to get back to school. After analyzing the public health data and working with health officials, our administration is announcing a new set of initiatives aimed to continue to contain and stop the spread of COVID-19 and to ramp up enforcement of the many COVID orders we've issued. Some initiatives will be effective statewide. Others will be more targeted to communities that are struggling currently with the spread of COVID in their towns. In some respects, we're entering a new phase in our battle against COVID-19. As I mentioned earlier, we've seen statewide metrics that have been on the decline for several months. But after studying the recent increase in percent positive rates, we'll begin reporting additional town-by-town data starting next Wednesday that shows the spread of COVID-19 at the community level. This information will be posted on a weekly basis. I'd now like to announce some updates with respect to our statewide guidance. Due to that slight uptick in positive cases, we are indefinitely postponing Step 2 of Phase 3 in our reopening process. 5 weeks ago, we laid out new economic sectors that could open in Phase 3. This uptick in cases and reports of people not adhering to the guidance we have put forth here in Massachusetts means we cannot move forward at this time or any time soon in the near future.